Hi Shelton, it's Dr. Buford. I'm here with Mitzi and Lauren and the rest of the operating team. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We examined your shoulder before we started, and you did have some laxity, just like we expected. It was multi-directional. And now we're just getting our first look inside the joint. The camera is coming in from the back, and in the front of the shoulder, you can see two different cannulas, or two different portals. There's a gray cannula coming through what we call the anterior superior portal on the right. And then here we have a switching stick coming through the anterior inferior portal. You can see how the switching stick is just above the subscapularis tendon, which is the anterior part of the rotator cuff. This ligament crossing right in front of the subscap is the middle glenohumeral ligament, and you can see how that attaches into the labrum right here. If we go a little bit to the right, the biceps tendon is what comes off the labrum right here, which is really 12 o'clock. As we look down at the biceps anchor, there's no laxity here. That's not detached. If it was detached, it would be called a type 2 slap lesion, but it's not, so you don't have that. The other thing we'll look at, just to make a quick assessment, is the rotator cuff, the other part. This is usually the part we have to deal with when there's a tear. This is the supraspinatus part of the rotator cuff, and this looks just great, nice and smooth. As we rotate the camera, we can see it inserts right at the smooth articular cartilage, and that's what a normal rotator cuff looks like. As we come all the way to the back of the shoulder, okay, recording. As we come all the way to the back, we can see the posterior part of the rotator cuff is the infraspinatus, and then there's a normal bare area in the humeral head. Let me try and get some of the bubbles out by flushing through. Okay, and so that looks normal. I don't see any significant injury to the bone, to the ball part of the ball and socket joint. The cartilage is pretty good. And so far, we haven't seen any significant labral tears. So the next step for us is to go ahead and have a look from the front to the back. We're going to put the gray cannula over that switching stick, and we're going to put the arthroscope where the gray cannula is. Okay, recording. Okay, so now we're looking from the front to the back. Okay, we're going to go ahead and take an instrument called a rasp and just gently roughen up the capsule here a little bit. You can see this instrument has sharp edges, and it's also got some kind of points in the central part that look like little mountains. And we're just going to start back here and just do a little bit of this. See that little fold? That's the posterior band of the inferior ligament. Okay, and that's where we're going to try and put our sutures in. The big decision right now for us is whether or not we use a suture anchor. And that depends on how much labrum you have and how stable or normal it looks. So I'm going to record short. Okay, so here's the posterior band of the IGL, and your labrum is kind of small, so I'm going to go ahead and put a suture anchor in just to make sure we have good fixation. You can see where 6 o'clock is. It's at the bottom of the screen. So 6 o'clock is basically right here. This is about 7 o'clock. We're going to place our anchor right about here. And I'm just a little concerned that there's not really a strong labrum to anchor into. So the next step, given that, is to go ahead and take a spinal needle and get a good angle down into the bone here. That looks pretty good. And so it looks like I can get an anchor down into the bone pretty reasonably right about here. So, with your left hand. So we're going to go ahead and take a little scalpel like a nickel skin. And then we have what we call a percutaneous guide. there you can see the guide just coming down. And back out the sharp inserter. And then there's our target. So we always want to get that kind of level. And that looks like a pretty good shot there. Pause. Let's try to pause.
Oh, sorry.
Okay, so here, so here's our suture anchor in, and you can see the sutures. That looks well seated. We're gonna, I got you now, Laura. I got you. So we're gonna go ahead and, so when you were Mitzi's, that's the issue, which is underneath the shoulder there. So we're gonna take one of the sutures, and we're gonna just pass it out the front here. Like that. And then from the left side of the screen, which is the back of your shoulder, we're going to take a turn to the right suture hook loaded with a black wire called a super shuttle. So here's the hook. It's loaded with a black wire right there called the super shuttle. And then we're going to take an instrument called the grasper and place that in the front. Now, looking on the arguments. So once we get our bearings, we're going to start here. We're going to rotate back. Place a stitch here. Okay, there's our first stitch. Recording. Okay, so there's our first patch. You can see how that goes underneath. And because we're going to do a mattress type stitch, we're going to go ahead and take out the second suture out the front also, which means we need to pass that other stitch to us. Like that, okay? And now we're going to use the same type of suturing instrument to make the same type of stitch. Pause. Okay, so now we're going to go ahead and clip the suture tails from this mattress stitch, and we're done with that. So you can see that's tightened up the back of the shoulder. I really don't think we need to do anything else back there. We're going to look down the front and probably place a plication suture in the front also just to balance the joint. Okay, so we placed another anchor in the front. You can see it there, or see the sutures from it there. Okay, so we're going to go ahead and cut the suture here, and we'll have a look at what we've done. Gotcha. And really what we've been trying to do here, Shelton, is just balance the joint. You did not need a major reconstruction because the labrum wasn't detached, but you did need a stabilization, and I think that's what we've done. You've got two mattress sutures, which is really 4 points of fixation, all designed to tighten up that inferior band of the or the anterior and posterior bands of the inferior glenohumeral ligament. You can see how much tighter that is in the front also. Ball looks like it's centered over the socket, so I'm going to stop there and hopefully that'll do the trick for you. I really don't want to over tighten. I just want to give you enough stability that you don't have those symptoms anymore. So good luck to you now. Bye-bye.